Now that we've been introduced to public health and understand the history of how we got to where we are today, let's look at a few more key concepts that will be important as we move forward. This list of key terms is included on the first page of Module 1.3, so please be sure to review. In public health, we are concerned with both morbidity and mortality. Morbidity refers to injury and illness. Here is the CDC webpage related to West Nile virus. This is an example of public health being concerned with illness. West Nile virus is not known to be a large killer of Americans, but it is an illness that is tracked by the Centers for Disease Control and Prevention. Mortality has to do with death rates, how many people in a population die each year. Here again on the CDC webpage is a page related to deaths in the United States. And you can see that they have the data plotted a lot of different ways. Here's a life expectancy at birth by race and sex. Here's one that is by state. I find this one interesting. I find them all interesting, but if you look at the map, you can see that the darker colors mean that there's a greater death rate per 100,000 persons. So dark blue is the highest, and then the light green is the lowest. So you have high death rates in these states and low death rates in these states. Can you think of any reasons why that might be the case? What might be some of the contributing factors? So previously we've looked at how public health has worked to reduce the spread of infectious disease through hand washing, through sanitation. Also, we disinfect it. We have worked with the prevention of heart disease and other chronic illnesses through blood pressure reduction, decreasing cigarette smoking, using aspirates, and also automated external defibrillators or AEDs. Highway safety. Every time I miss the green light and it turns red on me, yes, it's frustrating, but that is saving my life. And it is disconcerting to me to see the number of people that are running red lights right now. I don't know if it's because the streets are crowded and they don't want to wait, but that's a disaster waiting to happen. So please don't run red lights. But seat belts, airbags, all of these things are designed to keep us from injury and death. The physical environment, things like air quality, smoke detectors, asbestos removal, and noise regulations. So with regards to noise regulations and a safe workplace, did you realize that there are defined limitations on the level of noise that we can be exposed to at work? Well, the Occupational Safety and Health Administration has these defined. If you look on the left, there's a noise thermometer, and you can see that at 100 decibels, there's a risk of damage in hearing in 2 hours. This level of noise is what you'd get from a chainsaw, sometimes from stereo headphones. And you can look over on the chart on the right, and where it has 100 decibels, right here, it is 2 hours. And that's to protect our hearing, because hearing is vital for the quality of your life. So, whereas life expectancy has generally increased since the 1800s, we're finding that there is a decrease in life expectancy for current generations. This life expectancy graph can be found on mappinghistory.uoregon.edu. The web link is on the slide here, but what's interesting here is that the dark line is the life expectancy of an individual born during this year. So you can see as we've progressed, there was a little blip here. I don't know, that was probably a war or something that went on. But you can see that overall the life expectancy is increasing. So now if you look at men, and the black line is the average, you can see that for men, there's been an increase in life expectancy since 1850, But when you look at women, women actually live longer than men at this current time. So that's why it's above and the average is in the middle. So this is a graph that demonstrates that we have had an increase in life expectancy over the years. However, we are projecting that many children born today will not live longer than their parents. So this is due to a variety of factors. And there is an article from the Washington Post included in the module's reading for those who are interested. Equality versus equity. We hear the words equality all the time. America is all about equality. Equality would say that everybody gets the same thing. So in this example, you have a baseball game going on there, and there's a fence, and everyone got the same size box. But you can see that that's not what everyone needed. In truth, the taller gentleman didn't need a box at all, and the smaller gentleman actually needed more than one box. That would be equality, but what public health strives to achieve is what we will call equity. And that is where you give people what they need based on their needs. So in this example, the gentleman who could already see, he doesn't get a box. He doesn't need a box. That allows us to have an extra box to give to the person that needs it to see the game. Now in public health, what we're really now striving to do is not only provide equity and resources by giving people what they need, we're trying to get rid of that fence. Because if there were no fence there, you wouldn't need the boxes. So with public health, we're really striving for equity, and we're striving to create healthy environments for everyone.